Our topic today is about preventing pain during quarantine. And a lot of people are cooking more often and also baking more often than usual, and also spending time on laptops and computers. So what we end up doing is when we are cooking and chopping food and baking, we end up with this forward flex posture. So we'll talk a little bit about that, about what can be done. So there we go. Okay, so pain can have a purpose. One of the most common conditions we see as hand therapists is wrist fractures and carpal tunnel syndrome. Especially here in the Bay Area, I see a lot of patients with carpal tunnel syndrome. So just to keep things more fun and interesting, we are going to mix things up so you guys just don't have to listen to me talking all along. So let's watch this video. It's by the American Society of Hand Therapists. It's about carpal tunnel. So that's your carpal tunnel. It's a very narrow tunnel. That's the median nerve that can get compressed. We make braces for this. Yoga. Okay, so like the video showed, please do not self-diagnose. We make, as hand therapists, we make custom braces, or we recommend braces. If you buy braces off the shelves at a drugstore, those can keep the wrist pretty cocked up and actually put too much tension on that median nerve that we just saw. Now we'll talk about exercises as alternative medicine. So in our country, we have this huge opioid epidemic. Unfortunately, a lot of doctors, physicians prescribe medicines, but most often patients are not given a prescription for exercises. I'll be talking about exercises we can do during quarantine to counteract the forward flex postures. But overall endurance exercises also help with our perception of pain, and they help relieve pain by decreasing inflammation. So in 2008, physical activity guidelines were drawn in the United States, and it states that 150 minutes of moderate physical activity per week is recommended, or 75 minutes of vigorous exercise, in addition to twice a week strengthening exercises per week. And you can do your strengthening exercises using weights or bands, or you can go to a gym. Unfortunately, not at this time. Exercises also have psychosocial benefits. The psychosocial benefits especially help patients who have chronic pain. And there's a big difference between acute and chronic pain. Acute pain lasts only as long as the stimulus is applied, and it is protective in nature. So pain does have a purpose, but chronic pain is way complicated. And many times the injury, even after the injury has completely healed, the person continues to feel the pain. Chronic pain also has a huge neuropsychological process called central sensitization. And for chronic pain, especially generalized relaxation techniques like meditation and things like that help. So what can you expect when you see a physical therapist or an occupational therapist or especially a hand therapist? Ideally, if you have any kind of hand condition, it is better to see the experts. You can visit the ASHT website to find a hand therapist near you. You can also talk to your doctor about referring you on. To find a good hand surgeon, you can go to the website of the American Society of Hand Surgery. And seeing a hand surgeon does not mean you have to go through surgery. It just means that you can get a better diagnosis. So what are some of the things we can do for pain? So some of the things we do as therapists is manual therapy and physical agent modalities. So manual therapy includes joint mobilizations, a very specialized technique called myofascial release, and also some soft tissue massage. Physical, if you are in pain, you can try using a heating pad or an ice pack. And you can also use a TENS unit at home. But please make sure you use the TENS unit based on your doctor's recommendation or your physical or occupational therapist's recommendation, because they have lots of contraindications. So here are the typical quarantine postures that I was talking about. People are cooking more often since they are home. So here we end up with a forward flexed neck and rounded shoulders. And here's a picture of a man using his laptop. Ideally, laptops are not good for ideally, please do not use laptops if there's an option. Please try to hook up your laptops to a docking station because unfortunately, if you place them on your neck or lower, then you end up flexing your neck too much or bending it too much. And if you place them way up high on the desk, then you end up shrugging your shoulders too much. So there are studies that show that the average screen time for people these days is about 7.5 hours. So what this leads to is forward flexed neck posture, which leads to weakness, it leads to tightness of the pectoral muscles and tightness of the upper trapezius muscles here and the levator scapulae back here. And it leads to weakness of the deep neck flexors. So what we need to do to counteract, let's do some exercises to reset our postures. So to counteract the forward flex postures that we are going to get with a lot of computer use, laptop use, smartphone use, and a lot more cooking and baking, what we are going to do is we are going to do exercises to stretch these tight pectorals. And also we are going to do some chin tucks. And like it was announced in the beginning of the webinar, these are not supposed to be individualized recommended exercises. If you have any medical condition, please contact your doctor or your physical therapist or a hand therapist to get customized exercises. Okay, so let's start with shoulder shrugs. Shrug your shoulders and relax. Do 10 of those for me, please. For the next one, what we are going to do is we are going to squeeze our shoulder blades together. So squeeze, make that proud chest. And do 10 repetitions. Sonia, come here, please. Take a seat, right? Just squat down right here. Squeeze right here. Okay. Squeeze like you are squeezing my hand. So that's your goal, to squeeze right here. Squeeze and hold. Okay. Excellent. So ideally, you do not want sustained joint positions for more than 20 to 30 minutes. So whether you're working on a computer or cooking, make sure you take breaks every 20 to 30 minutes. And it's okay to do only 3 repetitions of these exercises, kind of stretch your pectorals. The other thing we recommend is chicken wings. All these exercises have to be done very slowly, very gently, and do not do them past your point of pain. Start very slow. And that is why we are showing very easy exercises to counteract those tight pectorals and also to reset that posture. So the next exercise, the chicken wings can also be done. Again, do this only if you can do it very gently while doing thoracic spine stretches. So like so. Go ahead and do it with me if you can. And then roll your shoulders back. Another very important exercise to reset the posture for the forward neck thing we have going on with increased computer use is to just tuck your chin. And you're not just going to look down, you're going to pull your chin back. In fact, you don't want to do it this way. You want it to come back because you are doing it to counteract the forward flexed neck. So a lot of my patients who are computer professionals or even in other professions would tell me that, even chefs would tell me that they do not have the time, but you owe it to yourselves. We are human beings. We are meant to move all the time, and we are not supposed to be working at a computer. So ideally, if not every hour, try to take a break at least every half hour to an hour and try to do only 3 repetitions. Even that can help. So 3 repetitions of all of these exercises will not take long. So what we are going to do is do 1, do the shoulder rolls, do 3, and then do the shoulder squeezes, shoulder blade squeezes, 2 and 3, and then your chicken wings, 1, 2, and 3, and then your chin tucks, 1, 2, 3. And especially for this one, the chin tuck, be very careful. Do it within pain-free range. If you experience any neck pain, contact your doctor. The ergonomics of the desk is also very important. Please adjust the height because, as I said, in the past couple of years, I've seen a lot of computer professionals, and some of them even said to me that, oh, it's normal for software engineers to have pain. And I had to tell them, no, I'm sorry, but it is not normal for anybody to be in pain all the time. So here is the picture. Ideally, the top line of your monitor should be at eye level. And try to use an ergonomic keyboard, especially one that will keep your wrist in neutral. to prevent carpal tunnel syndrome. Prolonged sitting is also bad for your back. And so what we recommend is high-low desk. We purchased one, it was just $400 on Amazon, and you can adjust the height to make the desk go up higher so you can do some of your work standing up. So it's ideally you should alternate between sitting and standing. Okay, joint protection techniques. So it's important to use your joints in an optimal position. Try not to use your thumbs to text. Try to hold your smartphones at eye level. Try not to flex your neck too much, because some of the nerves that go into the hand can get pinched by the neck. We also recommend these what you call it, pop sockets to hold the phone like so you don't have to grip, because just as the video you guys watched about carpal tunnel showed, constant gripping is not good for the joints of the hand, or constant gripping increases the pressure inside the carpal tunnel to 10 times of what it is supposed to be. And as the video showed, it's a very narrow tunnel, and there are 10 structures that pass through the carpal tunnel. Especially during quarantine, if you're cooking a lot, make sure your knives have thicker ergonomic handles. Same for gardening. If you've started gardening, or if you're gardening more than usual, make sure you purchase really good ergonomic tools with built-up handles. Or the least expensive way is to wrap a wash rag or something around the handles of your tools so you can have a wider grip. The carpal tunnel video showed some of the splints that we recommend. Generalized relaxation can help, especially chronic pain. So generalized relaxation techniques like meditation, deep breathing, mindfulness, yoga, and Tai Chi can help, because with chronic pain, it's more about retraining the brain and remapping the brain.